This film will tell you about the services at Hall Health Center, which are designed to help you stay healthy and in class. Over the next few minutes, you'll be seeing a depiction of common physical and mental health issues that face UW students and how Hall Health Center can help you feel better.
Allie, you're really not looking so good. I really think you should call Hall Health and a consulting nurse.
Okay, how do I do that?
Here's the phone number.
Okay.
Along with general tuition, you also pay a services and activity fee, which gives you several prepaid services at Hall Health Center. This includes calls to a consulting nurse to receive health advice.
I think it'd be a good idea for you to come in and see one of the consulting nurses.
Another prepaid service through the student activity fee is an in-person visit with a consulting nurse. Students can utilize this on a drop-in basis during Hall Health Center's regular hours of operation.
Hello.
Hi. I called the consulting nurse and she said to come in to get an appointment with her.
All right. Do you have your student card?
When you come in to see someone at Hall Health Center, it is incredibly important to bring your student ID card and any insurance information you may have, such as the insurance plan number, a letter documenting coverage, or your insurance ID card.
All right, I got you on their list to be seen by the nurse.
Consulting nurse drop-in visitors will be seen in order of arrival, though it may involve some waiting during the winter months. Usually, you'll be seen within 30 minutes.
It sounds like you got a bit of a cough. Has it been going on for a while?
Couple weeks.
Why don't we take your temperature and just see how
There
we're doing
is a
here?
billing insurance office available to answer questions concerning insurance coverage, either through a family member's plan or the student health insurance plan. If you don't have health insurance, you can still come into Hall Health Center. A payment plan will be set up. So don't let worries about cost keep you from coming.
Well, since you've had a cough for a couple weeks and you have a history of asthma, I think it's a good idea for us to get you an appointment with one of our providers.
Okay.
Are you available in a couple hours?
Yeah.
Another benefit from the list of the prepaid services is one office visit with a provider, like a doctor or nurse practitioner, per quarter.
Hi, Todd. I'm Kevin Carabine. I'm one of the nurse practitioners here. How do you do?
I'm just tired and
How long has that been going on?
several months.
For the last several years, the American College Health Association has been conducting student surveys to determine what are the top 10 impediments to academic success. Out of those 10, 8 are mental health related. The good news is that these are all treatable. And the bad news is that most students don't recognize that they have problems.
Well, one of the things that some of the symptoms you described sounds like is depression. And I'd like to take a minute or two just to go through a questionnaire that we use for all of our patients coming in that we think might be depressed. Is that okay if we went through that together?
So what are we doing to help the students? We provide rapid access to care by doing services like the same-day need, walk-in appointments.
This last question just is sort of a broad general question. How difficult have all these problems that we've identified made it for you to do your schoolwork or just sort of take care of yourself?
It's pretty difficult.
All right. What we get here is a score that shows relatively high for you. Definitely suggests to me that what might be going on here is depression. There's other things we want to think about when people are fatigued and tired, but we have a depression care coordinator, Nathan Calhoun, who helps us in the primary care clinic understand and manage and figure out how best to take care of people who we think might be depressed.
Okay, Allie, it's nice to meet you. Thanks for coming in. I understand that you're not feeling so well, so maybe just tell me what's going on.
I've just had a fever the last couple days and coughing for a couple weeks.
Okay, great. So what I'd like to do is just spend a few moments examining you.
Hi, I'm David Dugdale. I'm the director at Hall Health and I've worked here since 2006. I'm a general internal medicine physician by training and I use that every day to try to keep you as healthy as you can be. Our mission is to help you be as successful as you can be academically, and we do that in two major ways. First is by giving you access to state-of-the-art preventive health services. Secondly, when it comes to treating illnesses, we adopt the same strategy. Our mission is to keep you healthy and make you academically successful, committed to high quality patient care and patient service, and look forward to serving you here.
Good news is that it doesn't look like you have a serious infection in your lungs. You do
It is
have
important to know not all services available at Hall Health Center are in the prepaid category. Fees are charged for prescriptions, x-rays, lab tests, pharmacy, follow-up visits within the same quarter, and specialty services, such as mental health therapy, physical therapy, and the travel clinic.
Drink lots and lots of fluids. I'm going to have you get some over-the-counter agents just to relieve the congestion in your nose. I'll probably have you stay on this inhaler for the next 4 to 6 weeks, and then you can stop that. And I'm going to give you my card. I know you've signed up for eCare today, so what I would like you to do is check in with me by eCare over the next 3 to 5 days. If the fever comes back or if you're feeling worse, I want you to contact us right away.
Hall Health Center uses an electronic medical record system called eCare, which you can sign up for via the Hall Health Center website. If a student has a question for their provider after the visit, he or she can use eCare to send a message as well as request an appointment or check their lab results.
So what's going to happen is we're going to meet weekly for now, and then we're going to spread your appointments out monthly.
Another one of Hall Health's prepaid services is a visit with the Depression Care Coordinator, a vital resource for students having a difficult time coping with college life.
Sounds like something I can do.
Okay. So from what I hear, you're pretty sad, depressed, you're lonely, you're not getting out much, not going to class at all, can't concentrate. It's got to be tough. Okay?
While this service, as well as crisis intervention appointments, do not have extra fees, visits with therapists and counseling sessions at Hall Health Center will incur costs. Group counseling is a very affordable way to get help.
Do that before dinner or after?
Probably after.
A resource to keep in mind when the mental health clinic is closed is the King County Crisis Line, which is open 24/7.
Okay. So tomorrow, if possible, I'd like you to email me, let me know how things went yesterday. And we're going to plan some more things out for the week, okay?
Okay.
Okay. Well, Allie, I'm so happy you're better. Aren't you happy you called Hall Health?
Yeah, definitely. But now I just gotta catch up on all the school I missed.
Todd, I'm very glad that you've been coming to the group regularly, and it looks like some of the strategies we talked about in the group you have been applying with varying degrees of success in your life.
I feel not as tired anymore, and I have been attending classes recently.
Good. So this would be a good time for us to perhaps review the stuff that have worked for you.
Yeah, that sounds like something I can do.
Good.
Hi, my name is Lisa Yang, and I am a senior here at the University of Washington, majoring in physiology and anthropology.
And I'm Allie Pascal. I'm a senior majoring in women's studies and pre-nursing.
My name is Todd. I'm a senior at the University of Washington, majoring in biochemistry and chemistry.
I'm Adrienne Kraft, a senior and a biology major.
And we are peer health educators here at the University of Washington, a group of student volunteers with the University Health Education Leadership Program, otherwise known as UHelp.
The staff and volunteers here look forward to meeting with you about your healthcare needs.